Hello, friends, and welcome to another episode of the Concussion Nerds podcast. I am, as always, super excited that you're here, and I'm just going to be a total nerd with you for a second. My program that I record this podcast on just updated, and there was this new button. This new button is a media button, and I clicked on it, and there's all these sound effects. There's like a cheering and a clapping, and so I almost popped one in here, but I was like, we don't need to. But the dork in me was really excited about this new thing because it's just fun, right? And why do we do podcasts? Why do I do what I do? Because I freaking love it. It's fun and it is so important to people in this space. So, thank you for being here. If you are a dedicated weekly listener, you will notice that we didn't have an episode last week. And truly, honestly, time completely escaped me. Right? You know those days where you have lots of things on the go. And then what I actually did, which I talk about doing, that I don't do as often as I should, is I actually just completely disconnected. Honestly, I haven't been on my stories as much on Instagram. I just took some space for all good reasons. But in doing that, I also completely lost track of what day of the week it was. And so we are back this week. And we have a full lineup. Dr. Rachel's coming back in the next couple of weeks as well. We're going to be talking about sport. Dr. Rachel, if you haven't listened to her episode, the reason she got into concussion care was because of soccer and her athletic background. So we're going to be talking about some sport concussion stuff specifically on her episode. But today we're going to actually be talking about building your multidisciplinary team. But I'm going to take a bit of a different lens to it in this episode. You know, when we've talked about this in the past, we've just kind of like listed a profession and here's what they do. But what I want to do today is I want to talk about this in how I particularly work with other colleagues, because concussion can take a village, because sometimes I act a little bit more like the quarterback, right? Because here's the problem that I see happen. And if you're on a journey listening to this, you can either nod your head or tell me I'm wrong. But what I see a lot of the time is that an individual who's on a healing journey is seeing all of these providers because they've been recommended by one person or another, but they don't know how they kind of work together. And the providers generally, not saying always, but generally they're in different clinics and they don't speak, right? So we don't really know what one person's doing, the other person's doing, and how they could be working together. And so in this episode, we're going to talk about building this multidisciplinary team, but we're going to look at it through a bit of a different lens on how can the team members support each other a bit more so that their expertise almost carries more weight, and how can one person almost be a bit of the quarterback. That doesn't mean that they do everything, right? But they help you kind of oversee things more. So that's what we're going to be talking about in this episode. Before I dive into that, though, I do want to share one tidbit here. So this one is for clinicians. So if you are a PT, an AT, a chiro, an osteo, an acu, if you are a clinician working with individuals with concussion or wants to work with individual concussions, we have just launched a new segment. This segment is called the Clinician's Edge. It is literally your weekly dose of neuro wisdom in your inbox every single week. It may be a concussion tip. It may be a new study. It may be a way to challenge your thinking. It may be a new theory, maybe a new concept, maybe a treatment technique or tool to consider every single week to keep you thinking, to keep you energized, to keep you leading in this space. It is absolutely free. So if you are this one, my healing journey individuals, I know you're chomping at the bit on this too, but this one is for the clinicians. This is meant to help your practice clinicians grow and strengthen so that you can help those on an individual on a healing journey. To those of you that are on a healing journey listening to this, yours is coming. Okay, I have something for you too, and I'll share that next week for you, beginning of April for you. Okay. Multidisciplinary teams. First of all, why do we need a multidisciplinary team? Right? Let's start with the fundamental question. Why do we need a team? Well, when we look at concussion as a whole, and we look at the multiple profiles of concussion, and we look at not even the profiles of concussion, but we look at how concussion impacts somebody's life. And we look at the factors that we know that aren't even the concussion specific factors. Okay. What do I mean by this? I'll talk about in a second. But the factors that aren't even concussion specific factors, but that we know if we can improve can absolutely help us in our concussion recovery. Then there's no way one person can do everything. Right? Now, what do I mean by this? So let's start with not even the team for the concussion itself, but let's start with people that exist in this space that can support you. And when I say those other factors that aren't even concussion specific, let's look at nutrition, right? Nutrition is a huge piece that can be helpful in our recovery, hands down. But like anything, for some people, there's some people that talk about intermittent fasting. There's some people that talk about Mediterranean diets. There's some people that talk about, making sure that you need to cut out gluten and dairy. Like there's all these nutritional things, even around the space of concussion. But it's not a one size fits all for every person. I guess you guys must be so sick of hearing that, right? But this is what makes us humans. We are individually unique. I don't know about you, but most of us learn jack squat about nutrition. I was thinking about it. Like I have an 11-year-old son, and I think about some of the things they learn in school, and it makes me shake my head because I'm like, it would serve them so much better to learn things like nutrition, how to take care of your body and your brain, how to manage your finances. Anyways, total side tangent. But we do not learn in society what good nutrition looks like. And good nutrition can absolutely be a big piece in helping you in your concussion recovery. And not even just that, clinicians, if you're listening to this, like it's a massive piece in helping you feel energized. And like nutrition is fuel. We're using our brains every moment of every day. It needs fuel, and it needs good fuel. So in that area alone, that can involve people like nutritionists, dietitians. Naturopaths definitely guide through nutrition as well. Most of them. Functional medicine providers can guide through nutrition as well, right? But at a base level, a nutritionist or a dietitian might be someone who can help, or there's lots of nutrition coaches out there now. You just want to make sure they have that some training and understanding, obviously. But that fundamentally could be somebody who could support you in that piece of it. It doesn't mean you need to do it forever. By all means, get the information and move on if that's the way you can do it, to support that piece of healing, right? In terms of, we did a previous episode that talked about when I talked about on You're Not a Persistent Journey, we have kind of these three arms we have to look at, right? We have to look at the physiology, the psychology, and the lifestyle to move you from stuck to excelling. That's my overarching, overall, like holistic model. And that triangle is encompassed in a big circle that you feel safe. So from the physiology perspective, which obviously that's where most of you come to work with me, right? Most of you, when you come to Nanaimo to come work with me, or when you work with any other provider, it's because you want help on the rehab side of things. So again, we're going to talk about building this multidisciplinary rehab team because a lot of my clients see more than just me. Some of them don't. Some of them do. Many of them do. Let's talk about how I work with multiple different team members when I decide to bring someone else in and what that looks like. Okay. So now we're going to keep in mind, I work a little differently than most, right? So I'm going to kind of take this to how I would do this at a local level with people, but also how I work with people in my concussion program, right? So if you're new here, I run an intensive concussion program. So my clients fly into Nanaimo or come into Nanaimo. They work with me for a week in person, and then they go home. And once they're at home, I support them virtually for 3 months, but often they reconnect with their local teams. And so I support and will work with their local team should that be something the client and the local team wants me to do with them. Okay. But guys, let's just pause for a second. I'm totally tangent-y today. I apologize, but these little things just keep popping up in my head. And I missed last week, and I feel like I'm just so excited to be back here today. I have had 6 new concussion clients in the last week and a half, I think it is, on my schedule. And let's keep in mind, I don't commonly take clients locally. That's why I have an amazing team that supports our local community. Our clinic is booming. Like, we are full. People are getting a lot of concussions right now. If you're a physical therapist and want to come work with me at Symphony, send me a message. I'm hiring. Anyways, so I've stepped back into regular clinic rotation a little bit for the next little bit until things potentially mellow out. So in the last week and a half, I've had 6 new acute concussions. All of those concussions are in their first 2 weeks since their concussion. How awesome is that, right? All of those concussions came from the emergency department of our hospital. Let's talk about why I'm so excited about this. Because there was a period of time in my city where if people went to the emergency department, they were given some pretty shitty advice. And they'd find us months later. And then I met an amazing physician. He found us and he reached out. I really love medical professionals who want to work collaboratively together. And he reached out because he wanted to have a little bit more of an understanding of how our process worked and if he was doing the right thing, if he was referring people properly to us. So I invited him to come to the clinic. Networking is key in our local communities. And I'm saying this story right now because this is going to feed in beautifully to building your collaborative team. Networking is the fundamental base of it. So this physician had emailed us and said, I work in the emergency department. I've sent a couple people your way. I just want to double check to see if there's a referral process in place or if I'm doing this properly. He signed it and he put a phone number. So my admin, my client services individual, forwarded me that email and I read it and I was like, well, I could just hit reply to the email. I said, but there's a phone number here. So I phoned it. He answered, yay. But we had a really great conversation because I didn't know who he was. So we had a really great conversation about who he was, what his role was in the emergency department at our hospital. And so I invited him to come to the clinic to actually see our space and see what we do. Because when people walk into Symphony, they're a bit blown away, right? We are not your typical physical therapy clinic, but we're still physical therapists and chiropractors and all this, right? So when people walk into our clinic, particularly when they walk into our gym and our assessment area, they're blown away. And the same thing happened here. And I explained to him more about our process and our flow and how we work and why we use the technology we use and what it lets us do. And he was really excited. From there, he supported in helping me get to speak to additional physicians in the emergency department so that more of the physicians in that area could understand who we are, what we did, and I could truly highlight the importance of those referrals getting to the client faster and what happens and how we can work together to support this client in recovery. And from their role in the emergency department, it's not to understand how to treat a concussion. Their job, and I hammered this, is to be able to identify the concussion and refer. That's it. That is their job. They are the frontline person for so many individuals with concussion. Anyone that goes into the emergency department, they are the first person. They truly can start to make or break someone's course of recovery. And so what's beautiful is we had a really great conversation. I got to present to that emergency department, and we are consistently getting referrals. The last 6 I've just had all came from our emergency department. So when we talk about building a multidisciplinary team, that does include our physicians. That absolutely includes our physicians because so often they are still the front person. Networking is key. Sharing who you are and what you do is key. We live in this space and in this world today where people feel like we can't brag about what we do, right? We can't share in the really exciting way the changes we get with our clients and how we help people. And I think that's bullshit. Because if I'm not sharing with you who we are and what we do and how we do things different and the changes our clients make, how would you know? You wouldn't, right? So when we talk about building this multidisciplinary team, our physicians need to be part of it, right? They are really a big source into our world. We have the same relationship with some, not all, definitely not all, but with some of our general practitioners in town, right? Our clinic purposely is in the same building as a medical clinic. And in that clinic, I have purposely and again intentionally fostered relationships with certain physicians in that clinic. And then when those physicians leave and they move to another clinic and then they start referring from there, they start sharing who we are with them, right? I've absolutely reached out and made those connections. And now, again, we have certain physicians in this town that we are the only place they will refer their concussion clients to. The challenge in Canada right now is many people don't have a general practitioner. And then to see it, you're waiting weeks to get in to see your GP, that it slows the whole process down. So ideally, we really still want that education and that awareness that you do not, for most physical therapy clinics, at least anywhere in Canada, you do not need a referral to come in and see us. We're direct access. Give us a phone call, we'll get you booked in. Okay, so when we're looking at building our teams, our physicians are absolutely part of those teams, right? Everyone plays a role. Now, let's look at more the common players around this, okay? So when someone says to me, when I get a message on Instagram from somebody and they're like, I've got a concussion, who do I go see? Instinctively, and if you're not one of these two professions that I state, I apologize. But instinctively, I go to physical therapists and chiropractors. And the reason I go to those two professions first is because I know so many of them have that continuing education. Now, I know that there's occupational therapists and osteopaths and acupuncturists and athletic therapists who have also done extensive concussion training, but it's just not, the volume of it is not as high as physical therapists and chiropractors. So if I'm guiding somebody to say, go to Google, because that's, unless I know someone where someone lives, that's typically what happens. And I'll say, search physical therapists who treat concussion or concussion clinics in your area and see what pops up. I said, typically and very commonly, it could be a physical therapist or a chiropractor. Okay. What I do say to people is, I really don't care about what the profession is as much as, do they have concussion training? That's the most important part. But typically a PT or a chiro will be the first allied health, right? When we think of our professions, that someone will see. Now, this is where the type of training that therapist has really kind of sets the foundation for how they choose to refer people to or not. So let's talk about me and my thoughts on the process, because we absolutely work with people. So the big difference with when you come to Symphony and when you work with myself or any of my team is that we do a multi-system assessment. What does that mean? And I've talked about this so many times on the podcast, so I'm going to say this really quick. What it means is we assess every system. We look at your autonomics, we look at your vestibular, we look at your visual, we look at your somatosensory, we look at your neck, we look at affective/mood, we look at cognition. We look at what's working very well in each of those individual systems, what is not working well, and how are they talking, and are they talking together appropriately? Think of Chinese telephone, right? One person says one thing, pass to the next person, pass to the next person. By the end, the output, is it the same? Right? Or did it get garbly gunked somewhere in the middle in one of those stops that the output at the end is something completely different? You can use this when you think of your brain processing information for concussion, right? So the visual system says something, the vestibular system says something, the neck says something, the somatosensory says something, your mind, right? Your mood says something, and it starts to travel down the thing. And then there's a point, right? An integration point where these things should talk. Do they talk well there? Sweet. Conversation keeps going. There's another point. Do they talk well there? Great. There's another integration point. Do they talk well there? No. They get kerfuffled. And that then takes it to the next destination that's going to affect how you feel, how you think, how you respond, how you react, how you move. So what we do with our multi-systems assessment is that ability to not just look at the system, but look at those points and those integration points along the way to make sure everything is talking and understanding each other to have the movement and output that you want in your life. That's what we do. I learn more and more that is not, when I say I'm here to set a new standard for what concussion healing and recovery looks like, that's the standard I want every single concussion clinic doing. That's not what's happening right now, right? So in a lot of places, what happens is that an individual assesses parts of a system, or they like systems that they're skilled in, right? There's definitely physical therapists or chiropractors who are very niched and very knowledgeable in one system specifically. Then they'd probably kick my butt in knowledge in that area, to be honest. But then that bigger picture to be able to step back and look at how things are talking and integrating becomes not as great. However, that doesn't mean they're not skilled and knowledgeable and can't help you. Okay. So that first point of access is usually a PT or a chiropractor. They will do their assessment and guide you. They usually initiate treatment and then kind of guide to other ways. Now, for me, when do I start to bring other people in, and who might those people be? So like we assess a little differently, we also treat a little differently, right? We absolutely have skills to pull in and integrate vision and the neck and all these different pieces. But here's some exact scenarios of when I might bring someone else in and why. So let's talk about the neck for a second, okay? Particularly if you're an acute concussion. If you're an acute concussion, your neck, any concussion, but your neck cannot be ignored. When we look at the mechanism of why a concussion happens, right? It is an acceleration, deceleration injury. Whiplash is always a component of it. So we must look at the neck. If the therapist, that's kind of your lead therapist, isn't strong in the neck, or it's not an area that they tend to treat, then we're going to want to bring somebody in who is. So there was a period in my practice that I had a very strong orthopedic physical, and I still do have orthopedic physical therapist on my team. So if I have a client that I feel like absolutely needs to have some manual therapy done to help with building some range of motion and pieces like that, and needs a strong manual component, I will bring that person in and they'll do a series of sessions, and usually so that we can help to increase the range of motion and all those pieces of the neck. The part of the neck that I'm really good at, I can do IMS, I can do muscle retraining, I can do strength, I can do motor retraining, I could integrate the neck with the other systems beautifully, and I can help you know where your head is in space. Those are my strengths with the neck. The manual piece of mobilizations, some soft tissue stuff, all those pieces can do it, but I don't have my levels in orthopedics, right? I'm not someone who's spent hours looking at the neck. And so if I feel like I need support in that area, I bring that person in. That could be a physical therapist, that could be a chiropractor. Particularly if I think the upper cervical spine is a driving force behind why we might be having increased symptoms. And why do I think the upper cervical spine sometimes? What are my kind of triggers? And you know what? I have a good friend who's a new chiropractor, which is upper cervical spine. And I think I'm going to bring him on the show so we can talk a bit more about just about that upper piece. And Dr. Sasha Blaskovic, there's an episode with him that we talked all about the neck too. But really, people will complain of pain right at the base of the skull. And they complain about it as like it's a deep pain. And it's almost like this ache. That symptom alone is almost always a symptom that I'm like, let's go. Obviously, if you can do your cervical spine test too. And if you're feeling lots of restrictions in that upper cervical spine, so one of the tests is a cervical flexion test, is a test that really does help you. It's got a huge sensitivity for a cervicogenic component of dizziness, right? So there's supine, cervical flexion, and rotation test. Huge sensitivity for cervicogenic dizziness. That's one. Another test as a physical therapist you can do to look at if the cervicogenic component is the dizziness is the swivel test, the smooth pursuit head torsion test, right? These are all tests in your assessment that help you understand if the neck is a driver of cervicogenic dizziness. or if cervicogenic dizziness is one of the pieces to the picture. But really, if there's a lot of that upper cervical piece that I can feel and that we're working on and that I'm not making progress, I can bring in an upper cervical chiropractor as well. So physical therapy. And then if we're looking at a lot of manual pieces within the neck, I might bring in an orthotherapist or an upper cervical chiropractor. Okay. Massage therapy can always be a nice adjunct if there's a lot of tissue tension, recognizing that that tissue tension is there for a reason. So sometimes it might be that because we need to be working on the fundamental root piece of the neck or the vestibular system that could be driving that muscle tension, but massage can give relief for sure. Let's talk about neurooptometry, right? So neurooptometry, when we talk about vision being impacted after concussion, vision, the task of vision is a huge percentage of our brain, huge. We use vision in every aspect of our life almost. But when we're looking at vision, we're looking at multiple different things, right? So we're looking at ocular alignment, we're looking at suppression, we're looking at are our eyes working together appropriately? We're looking at can they move through space together appropriately? And then how do they take in that information and how does our brain process it, right? So there's a huge continuum of things along the vision aspect of treatment. There are some parts of that physical therapists can do well and chiropractors can do well. And there are some parts of that we need to refer to our neurooptometry colleagues. And there are some times where, as a physical therapist, you don't have an idea what to do with vision. But if you recognize that vision's an issue, or if your client continuously is complaining about their eyes, they should probably see a neurooptometrist. Where we work with neurooptometry really beautifully is we can, with a client, identify if vision is a factor, and particularly if there's a strong alignment issue, sometimes too, or vertical alignment issues, and we'll refer to neurooptometry and they will do their assessment. And what we do a lot of the time is they will, if a prism lens is going to help support our client with decreased symptomology and help us with rehab, is they'll start with the prism lens and then they'll come back to us and continue to do the work. And then at some point, particularly if there's like a strong accommodative piece or some other levels, then we will refer back to neurooptometry for further work. So sometimes that looks like they do a bit of work with us, then they go see a neurooptometrist, then they come back and work with us. Okay. Osteopaths, craniosacral therapy. We don't hear about as much of them in the space, but they can be a really valuable player in the team for a couple different reasons. One, it's just such a gentle treatment for the most part. It can be really powerful in helping calm your nervous system. Okay, and we've talked on previous episodes about why that's important. Osteopaths, craniosacral therapists can be really great in helping calm the nervous system. The other thing that both those therapists do is part of their role is they help shift fluid, right? They do the work on the body in a really gentle way to help cerebrospinal fluid flow. They help with the tissue and the lymph and all those pieces. So particularly individuals who complain of those pressure headaches being a big issue for them, I will tend to refer them to osteopathic or craniosacral therapists as well. The pressure headache specifically is for me. And if you're an osteo listening to this, you might be like, and I can do this and this. Please feel free to message me and tell me. But osteopathic craniosacral therapists can also be someone that can come into play in that piece of things. Mental health providers, right? So if we look at psychologists, clinical counselors, I feel like they all have different names, licensed mental health providers in the United States. When we start to bring, it always comes back to this question of, do we have the capacity to do what we're doing too? That's a whole other episode. Mental health providers. So let's give an example here. So when someone is embarking on a journey of the mental health work, that takes a lot out of them often. And so when we bring any of these providers in, we need to very much be aware of scheduling and how things are being scheduled. You would not want to put your mental health appointment directly before your physio appointment. You probably don't even want it on the same dang day or the day after, to be honest. Especially if you're doing work like EMDR. And this is a unique example that I want to talk about. So I'm a huge fan of EMDR, huge fan, right? It's what absolutely helped me in my life, hugely helped me in my life. So I'm a big fan of it. EMDR is a eye movement desensitization reprocessing therapy, is technically what it is. but they don't have to use eye movement. And so this is where you ideally want to connect with a therapist who's willing to talk to your physical therapist or has that concussion training in themselves, because I'm going to say for 90% of the people after concussion, you don't want to use your eyes for this therapy. But the beautiful thing with EMDR is that it just requires bilateral sensory stimulation. That could be vibration, that could be touch, that could be sound, it could be light, right? It can be multiple different things. Now, this is where my brain kicks into play. The task of EMDR, and this is a really great example in my brain, I think about collaborative care, okay? The task of EMDR requires your body to have bilateral stimulation while you're reprocessing the therapy. This is the whole point of it, okay? Well, what happens? I'm going to caveat, no research that I know of has ever been done on this. This is just where my brain goes. What happens if the concussion has impacted your ability to process sensory information through one side of the body as well as the other, or to process certain types of sensory information? Would that potentially impact the positive impact of the EMDR session itself? So what do I mean by this? What if they're using the vibration? So one of the tools they could use are these little vibrating things that you hold in your hands. What if, because of the concussion, you're not processing vibration through one side of the body as well as the other? Could that potentially impact the success of the EMDR? I don't know, but I can't help but wonder if it would. So what if, because we do an assessment that looks at how you process pressure, vibration, touch as a whole, not all of them are always impacted, and not all parts of your body are impacted the same as well. So what if your physical therapist could talk to your EMDR therapist and say, Jane doesn't do great processing vibration through her hands right now, through her upper extremities, but she does really great with like gentle pressure through the legs. And this is what I did with my therapist in our clinic. So then she wouldn't use the buzzers because we knew there was just a sensory processing error with the buzzers. She would use pressure and touch in an alternating rhythmic pattern on the person's legs. And then we worked with the person to help improve their sensory processing. And once their sensory processing was improved, then our therapist could shift into using the buzzers. I feel like that is just one of the most beautiful examples of how two professions who normally wouldn't think to work together can collaboratively work together for the better of the patient and better outcomes for the patient. Because I know that if a patient is working on the trauma side of things and resolving trauma, that increases their capacity to do the work with me. But I know that I assume, this is and again, total assumption, but if I can let the therapist know which sensory modality they're processing equally and better, and she uses that for her EMDR therapy, potentially that helps the EMDR therapy be better. It's such a beautiful way on how we can collaborate together, right? When I start listening to my client history, we always ask about past medical history. Is there past viruses, past illnesses, autoimmune? We really want these informations because that's also going to impact a person's nervous system. And if someone starts listing some of these things, that is not my scope of practice and that is not my area of knowledge. The next question I'm going to ask them is, are you working with an individual for these things, right? And if they're not, then that's typically where I'm going to refer to something like functional medicine or naturopaths, right? So who are the common, I just realized it's 37 minutes and I try to keep these to 30. So who are the common players when we look at a concussion team? Physical therapists, chiropractors, they tend to be your quarterbacks, okay? They're the individuals that'll tend to work on things like the neck, the vestibular system, movement as a whole, right? We need to get you moving. So movement as a whole, posture, pain, those types of pieces, the nervous system, right? So we'll kind of work on all the vision, and many of us do vision stuff as well, right? But they're kind of usually your quarterbacks. Then we have our neurooptometrists. Those are our vision people, right? So they can help us with prism lenses. They do vision therapy to actually continue to help rehab that visual system. Really, the visual therapist and the physical therapist should be chatting to make sure that you're not being overwhelmed, because both those therapies together is a lot. Okay. And so it might be that you dance between them. It might be that they look at how they can work together in an effective way. Acupuncturists are another really common one. Also can be fantastic with helping, especially if you look at an acupuncture student who does auricular acupuncture or scalp acupuncture. So looking at blood flow, looking at sleep, looking at pain management, so many factors, nervous system pieces as well with acupuncture. Craniosacral and osteopathic care we talked about, right? So that they can definitely help with the nervous system side of things, really shifting kind of those fluids as well. So they can help with pain and much more than that. But that aspect of things, mental health providers obviously is a really big one. And again, I tend to lean towards those that do more somatic and trauma-based work for my individuals with concussion. There was a study that came out that looked at ACT therapy versus CBT therapy and persistent concussion and found some wins for someone who does more along that ACT side of things. That's a whole other story. I'm forgetting things right now. Holy Dinah. And then there's things like kinesiologists and personal trainers can come into play if we are to really help with that movement integration piece of things. We talked about nutritionists and dietitians. We talked about, oh my gosh, occupational therapists. How did I not say this? Occupational therapists and speech pathologists. So occupational therapists and speech pathologists can come into play in the beginning stages. So particularly if you're looking at return to school, if you need support with return to school, it can be very helpful there, as well as in persistent when we need support with management strategies. And then down the road, when you're looking at some cognitive rehabilitation kind of in more depth, okay? And then they have a whole other slew of toolbox. They can often help with the really to help you function in life. So they have tools to help you with planning and pacing, with breath, with all the things. You might be someone who brings on a breathwork coach just for yourself because breathing is a piece of your picture and it's something you want to do. I have my own breathwork coach as well. I think what I need to highlight bigger than anything is, yes, athletic therapists. Oh my gosh. There's so many different professions that at this point can play a role in concussion recovery. Every individual's team is going to be unique to you. And truthfully, it's going to be unique to you in both what you need, but also in what the skill set of your clinicians are. To put it very blunt, right? Like the skills you have as a clinician are going to also play a big role in who else needs to come into the picture. And that's not a bad thing. It's just an awareness thing. I don't think there's any right or wrong clinician if it's helping the client. And that is the big thing. Is whatever you are doing on a healing journey and the team you have, is it helping you move forward, or are you feeling overwhelmed, your wheels are spinning, and you don't know what the heck is going on? If it's helping you move forward, beautiful. If it's causing overwhelm and making you ask a lot of questions, then you need to pause, step back, speak with the quarterback, whoever that person on your team may be, and maybe have a discussion on where things are at and what could kind of be stepped back or adjusted for the time being to continue to help you move forward. Okay, my friends, I'm at 42 minutes, so I'm going to stop because I feel like I could just keep tangenting. I hope you enjoyed today's episode. Looking so forward to being back next week. But until then, have an amazing day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.